All right, so here in our office, we take care of lots of patients with shoulder complaints. And the shoulder is actually a very complex joint. It's made of the glenohumeral joint, we have the acromioclavicular joint, you have where your clavicle goes across into your sternum, and each of these bony structures are part of what creates the stability for the body. And then on top of that, we have a variety of muscles, both in the anterior, the lateral, and the posterior, that all allow for movement and stability. So when we do an assessment of the shoulder, we go through the orthopedic examination to pinpoint where the injuries are coming from, and then we do a biostructural exam to determine if there's movement or fixation within the joint. Here, what we've experienced is the glenohumeral joint, the humerus, is actually shifted forward. And upon further assessment of the spine, we notice there is some postural asymmetry, so some rounding here in the upper back, as well as an irritation right here in the mid-neck. And this is a primary area of the body where these nerves exit and actually innervate the muscles of the shoulder. So as we get into the assessment and protocol, it starts with that initial diagnosis, and then the treatment plan is stabilizing the spine, reducing interference to those nerves that go to the structure of the shoulder, working on improving the posture, and then I'm going to show you how we actually set that shoulder into place. So the first adjustment we're going to do is going to be right here at the neck. This is that primary area where that nerve exits into the shoulder. So I'll have you bring your shoulder back. And this is right at C5, level of the spine. Perfect. And we're checking, we got full joint mobility in that area of the spine. And then we assess back into the shoulder. So again, it's the humerus, the arm comes up into this ball and socket joint. And as it's shifted forward, we want to set that joint back into place. So to do that, we'll bring the elbow up and in, holding here, creating that angle, stabilizing this joint, and then set in place. Perfect. Okay, and then we'll check motion again. So following that adjustment, making sure that ball and socket is set into place, and that's part of what we're working towards, restoring that balance here in this area of the body and addressing primary shoulder complaint, removing nerve interference, assessing muscles and ligaments of the shoulder, and then setting the joint into place.